Hello, everyone. Just want to say welcome to our webinar. Thank you so much for joining us today. My name is Dr. Casper. We're here with Dr. Newsom, and he is going to give us a wonderful lecture on joint health essentials, which I think a lot of people probably have questions about. So here we go. A little bit about Dr. Newsom. He is one of the assistant program directors, and he is our director of sports medicine at the Mount Carmel St. Anne's Family Medicine residency. He also recently became the PCP for the Columbus Fury, which we are very excited about. He did his medical school at Northeast Ohio Medical University. His residency was here at Mount Carmel St. Anne's. He then went on to do fellowship in sports medicine at the University of Louisville, which you have to make sure you pronounce correctly. He is board certified in family medicine and then also sports medicine, and he practices here at Mount Carmel St. Anne's Clinic. And then on to you, Dr. Newsom.
Thank you so much, Dr. Casper. Welcome, everyone. One thing that I wanted to say before I forget to is if any questions come up throughout the talk, please enter those in the Q&A and we'll do our best to answer all, if not most, at the end here. But our goals for today are to learn about common causes of joint pain, easy prevention tips, and how small lifestyle changes can make a big difference in maintaining your mobility. And then discovers how to keep your joints healthy and prevent pain with some simple daily life habits. So musculoskeletal pain affects a lot of people. According to the CDC, about 25% of adults are diagnosed with some form of chronic joint pain annually, just in the United States. This includes osteoarthritis, that's your general wear and tear arthritis, rheumatoid arthritis, gout, lupus, fibromyalgia. Most of the time, your symptoms include pain in or around the joints, swelling or redness around the joints, feelings of stiffness, a grinding sensation with movement, and then general fatigue. So now we'll just kind of go through a quick overview of those different causes of joint pain. One of the more common ones being osteoarthritis. This is your wear and tear arthritis. It's caused by degradation of the cartilage in your joint spaces. So you can think of the cartilage as the cushioning, gliding surface in your joints. And with wear and tear, that can break down and become more rough. As you can see in the picture there, it becomes irregular. And you can imagine how that would be less ideal than the picture on the left, which is a joint space that does not have any arthritis. It causes breakdown of the cartilage, ligaments, and bone, and it affects more than 3 million Americans right now. Another cause is rheumatoid arthritis, commonly known as RA. It's an autoimmune disorder where the immune system attacks joints and organs. It can cause inflammation throughout the body, not just the joints, but around the joints as well, and your tendons, your bursa sacs or cushion sacs. And it cause a lot of irritation in the joints. And there's quite a few new cases of RA diagnosed every year in the US as well. Then we have gout. Almost everyone's heard of gout. It's a disorder that causes sudden attacks of severe joint pain, swelling, and redness. It's caused by a buildup of a chemical called uric acid, and that causes crystals to form within the joints and soft tissues. Typically, the first attack happens in the big toe, right where your toe meets your foot, and repeated attacks can cause inflammatory arthritis in that joint and break down the joint space as well. There are some risk factors for developing gout that includes high blood pressure, diabetes, kidney disease, certain types of anemia, being overweight, eating excessive amounts of protein, and drinking too much alcohol. Lupus is another autoimmune condition where the body's own antibodies will attack itself. Any part of the body can be affected, one of those being the joints, and that can lead to chronic joint pain as well. And then we have fibromyalgia. That is a chronic condition that causes widespread pain and inflammation throughout the body. It's associated with other symptoms like fatigue, trouble sleeping, headaches, belly pain and cramps, depression, and other mood issues. The pain can range from being barely noticeable to being very debilitating. And a lot of times it's worse in the morning than in the evening. In the middle of the day, we do okay. It can affect any part of the body, but most often starts in the neck and shoulders, kind of up in your trap muscles. And The pain gets worse with activity in cold, damp conditions, similar to what we've experienced here in Ohio for the last couple weeks, as well as anxiety and stress. And then the last one of the more frequently seen here on our end is a trauma. That would be an acute musculoskeletal injury from a traumatic event. It can happen at any time, involve any area, and can lead to more chronic symptoms depending on the location and severity. Think rolling your ankle, twisting your knee, spraining your wrist, something like that. That can obviously lead to some joint pain. So now we're going to shift gears just a little bit now that we know a little bit about the different causes of joint pain and talk about the lifestyle modifications that we can undertake to help improve our joint health. So one of the biggest ones is maintaining a healthy weight. Being just 10 pounds overweight puts 15 to 50 pounds of extra pressure on your knees every step that you take. Weight loss can significantly reduce joint pain, inflammation, and improve your physical function. Every pound a person loses takes 4 pounds of pressure off of the knees with every step, like I said. So if you think about that, losing 5 pounds takes 20 pounds off your knees. And if you need another way to kind of think about that is go to your local gym or even sporting goods store and pick up a 20-pound dumbbell and just imagine that being taken off of your knees every step you take. And you can just kind of easily see how much pressure that can take off your knees and improve your pain and mobility. Weight loss can slow the progression of joint space breakdown. That we don't have a way of reversing the breakdown other than joint replacement surgeries where we just switch it out. But weight loss, healthy diet, exercise, like we'll talk about here shortly, can help kind of slow that progression and keep your joints healthy as long as possible. Like I said, regular exercise is super important. It increases strength and flexibility, can reduce pain, and helps combat fatigue. Think of it like you're getting in shape, like if you ever played sports in the preseason, getting ready for the season. It's kind of the same thing, except now we're in the game of life. You want to focus on exercises that strengthen the muscles around the joints, but do not stress the joints themselves. There's a lot of different ways to do this. If you have any questions about that, sometimes at gyms, there are trainers and things like that that can help you with that. Specifically, there are some different exercises like leg extensions in the gym that can put a ton of pressure on your knee joint and can actually worsen your pain. So you just want to be really careful when you're doing different lifts and stuff like that. You want to initially focus on stretching and range of motion exercises and then kind of move into progressive strength training. You want to be sure that your body can go through a healthy range of motion before you start putting stress on the muscles, tendons, and ligaments, because that can put extra stress on joints in an incorrect way and lead to more pain down the road. Great low impact exercises, if lower extremity stuff is your problem, is cycling, riding a bike, spin bikes, recumbent bikes at the gym where you lay back. Those are all good. They help strengthen your leg muscles and don't put a ton of stress on your knee joints. Walking, swimming, water aerobics, Tai Chi, yoga, all low impact and can help with strengthening flexibility and mobility. Especially initially, if we're trying to just get into an exercise program, you want to kind of avoid going 0 to 100 too fast. So going right into running, jumping, high impact aerobic exercises and repetitive motions can cause more issues than benefit initially. But you kind of, similar to the weight training exercise, you can kind of ramp yourself up into those activities. So when you're doing exercise, the American Heart Association recommends at least 30 minutes, at least 5 days a week, for a total of 150 minutes a week of moderate intensity aerobic activity. That is the walking. You can think of that as that is what moderate activity is. Vigorous activity is running. So that lowers your overall time that you have to put into it, but also can increase the overall load that you're putting on your joints as well. But you need 25 minutes of that at least 3 days a week for a total of 75 minutes. The new thing that's been added is trying to incorporate more actual strength training. There's been a lot of data out there that doing strength training can help improve mobility, overall strength, bone health, and keep you active for longer. So that's another thing to try to throw in as well. So when you're doing these exercises, you want to avoid anything that's causing you more pain. When you're kind of working through something, one thing to kind of think about is a 4 out of 10 pain can be okay. And what that means is it's pain that doesn't alter your mechanics. So you're not, if I lean a little bit over to the left, I can walk and it doesn't hurt my right knee. That's not okay. That's going to cause more pain in your hips, your ankles, your back, and going to predispose you to getting an injury. The pain is not the sole focus of thought during the activity. So every step's not ow, 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 my knee, my knee, my knee. And then it does not interfere with your daily life after you do it. If you're able to keep it below that threshold, we're typically okay. We're doing more good than bad. So, yep. The other benefits, it can help with healthy weight management, which we discussed. It is absolutely essential to help with your heart cardiovascular health. Like I said, can increase mobility and strength and help prevent falls. We want to try to prevent as many falls as possible, and keeping your body working the way that it should can help prevent that. Some tips, you want to warm up before starting an exercise, and that can be, if you're going on a walk, start slow and then build yourself up into your typical walking pace. This will help with stiffness and inflammation. The other thing is to cool down afterwards. Don't go really hard working out and then just stop, because that can lead to more stiffness and pain afterwards. You want to stretch after you exercise. When your muscles are warm, that can improve your mobility. If you stretch a cold muscle, it can put a lot of stress on your tendons and other soft tissues, and actually can make the exercise a little less beneficial if you stretch beforehand. So you want to do it afterwards. And then if you're having persistent or worsening pain, come see one of us, and we can take a look at it and see what we need to help you out. A healthy diet is also really important. It can, one, help with weight management. That's not earth-shattering news, but there are different foods that can actually help reduce inflammation. Fruits and vegetables have antioxidants in them that can help protect healthy cells. And then there's some data out there that omega-3 fatty acids can actually help combat inflammation as well. And that's found in your fish, seeds, beans, nuts, stuff like that. And that can help with your joint health as well. A big one is to stop unhealthy habits. Quitting smoking not only is going to be the number one impact of your respiratory, cardiovascular, overall health, well-being, can help with your joint pain as well. Smoking causes inflammation, inhibits natural healing, reduces blood flow, and makes it harder to recover from exercise. The other thing is neck and back pain can be triggered by smoker's cough. So if we're coughing all the time, that can get your ribs, chest, back sore. So quitting smoking is absolutely number one priority if that's something we need to work on. Smoking, drinking alcohol, and overeating can also interfere with healthy sleep, which you need to have adequate recovery and help reduce inflammation as we kind of work into more physical activity and just general living. Another big one is to manage stress. Joint pain, immobility are huge stressors, and having long experiences with pain can actually cause your brain to have some rewiring in it and become more sensitive to pain. So it's kind of a self-fulfilling issue. And stress and fear can make the pain more potent. So we want to try to do things that can help with that. Exercise, spending time outside, things like that, just kind of working to manage your stress are going to be huge in helping this. But other things you can do are mindful meditation, mindfulness, and then yoga can work similar, where you just kind of can work through those different issues and hopefully decrease stress levels and see some improvement in your pain symptoms. So some other aids for joint health, obviously physical therapy is huge. If we have a specific issue or an imbalance or something like that, physical therapists are the best at kind of correcting that and helping us work through that and finding a healthy movement pattern, etc. So seeing a physical therapist can help alleviate pain, help create focused exercise and treatment program to help with your specific needs. Heat can be really helpful as well. Warm baths, showers, heating pad, they can help kind of loosen the muscles up. You want to be careful not to burn yourself, and you never want to sleep on a heating pad. It can actually cause burns. A lot of them now will turn off after 20 minutes or so. So this doesn't happen. But I have seen people that have the perfect rectangular on their back from falling asleep on a heating pad that burned them. So you want to kind of limit that use to 20 minutes and make sure that there's some layer of cloth in between you and the heating pad. Cold can be helpful for acute inflammation or after a bout of strenuous exercise to kind of reduce all that inflammation there. Massage, uh, who doesn't love a massage? It can help with stiffness and help decrease pain as well. Like I said, quality sleep, getting 7 to 9 hours can help with your natural healing processes and help reduce joint pain. And then posture can be really important too, because if we're in a bad posture, it can put stress on joints in a way that they're not meant to be stressed. So that's one thing to kind of work on too, is make sure that you're in a good posture. And here is a demonstration of having good postures. And you can see on that picture on the right, all the different angles that are there, and they can put stress on your hips, your back, your neck, and can lead to pain. So we got through it. Just a quick overview. There's multiple causes of joint pain. The biggest lifestyle changes that can help are maintaining a healthy weight, getting regular exercise, watching your diet, stopping unhealthy habits, and managing stress. When we're making these changes, you want to start slow, and you're more likely to keep up with an individual change at once. So if we're wanting to go to the gym 2, 3 times a week, focus on that, and then kind of throw in different diet changes. Or if you're smoking, let's stop smoking and then kind of go into that. When we do too many things at once, it's really easy to not do any of them. So we kind of want to focus on something and hit that goal. If the pain is persistent and keeping you from doing the things you enjoy or causing you to regular take over-the-counter medication, see somebody. We're available. We can kind of do the workup, see if there's something we need to kind of help with, or if there's a different way of doing things to try to get you feeling better. And the biggest thing is stay active. Movement begets movement. So the more that we're doing, the healthier those joints are being, and hopefully the less pain we're dealing with. So here is a QR code if you need to schedule an appointment to help discuss different things for your joints, your mood, your stress, smoking. We're here and available. And then this is a QR code for a knee health assessment where it can kind of work you through some different questions and help see what are some things we can do to make sure your knees are nice and healthy.
Awesome. Thank you so much, Dr. Newsom. I really appreciate your talk, and I especially appreciate the section about how mood can actually affect our perception of pain and our perception of, can I actually continue with mobility when it hurts so much? So thank you for addressing that. And now we do have some questions in the chat. One that I think you were anticipating, and so was I, tends to deal with some of the supplements. So I think we'll start there because people do have a lot of questions about that. It looks like there's two, one about glucosamine chondroitin specifically, and then another one about oil fish capsules. Do you have thoughts on either?
Yep. So there's really mixed data out there about glucosamine and chondroitin. One thing to know is it's derived from shellfish. So if you happen to have a shellfish allergy, you want to stay away from glucosamine and chondroitin. That's not one that's typically kind of out there in the open, but some people it does help. Other people, they don't notice much of anything. So if it's something that you're wanting to try, it can be worth a shot. But 50-50 on my success rate, and that would probably be a little bit of an overestimate, I think. But it can help with kind of the hydration and health of the joints in some people. Fish oil kind of goes with that anti-inflammatory diet like we were talking about earlier. And that can help with a lot of things, making sure we're getting those healthy fats in there. So it can be beneficial, but kind of similar to the glucosamine chondroitin. Some people it helps with pain, some people it does not.
And then jumping off of that a little bit, what are your thoughts on gel injections?
They can be really helpful for people. They tend to work a little bit better in earlier arthritis as opposed to later arthritis, because basically you can think of it kind of like an oil change in your joint. The gel is hyaluronic acid, and that's typically found in your joint. It's the thick, cushiony part of your joint space. So basically, it's putting a bunch of that in there and trying to keep the joint nice and lubricated. It works really well for some people. Steroid injections are another one. So those are things to talk about with your doctor or a sports medicine doctor, orthopedic surgeon specifically, but they can be very helpful.
And I suppose just a plug for you that you do both types of steroid and gel injections, correct?
Hmm.
That's awesome. Okay, there was another question about do you believe that one glass of wine can wipe out the benefits of a workout?
That's a tough one. So that it seems a little extreme that one glass of wine would ruin in the entirety of a workout. But the one thing that can be really true with alcohol is it can affect how you sleep. And kind of how we were talking, getting that 7 to 9 hours of good restorative sleep is really essential to recovery. So having that alcohol can kind of keep you from getting into the good, deep restorative sleep. So there is some data there and some thought there that could be affecting it that way. But as far as the physical fitness gains and stuff like that, I don't know that it would have a huge detriment there, but it absolutely can affect your sleep.
Thank you so much. There are a couple of questions about these slides being sent out, and I believe that is the case, correct? So if you've missed something, the QR code or anything, we'll be sending these slides out. There is also a question regarding best specialties physician that you should see for an initial diagnosis. They're asking ortho rheumatology, but I think I would take the question further and ask, do you need to see a specialist to begin with in general?
Yeah, I am also a family doctor. I do family medicine and sports medicine. I think in our training, we're more than capable of kind of doing that initial workup and getting you where you need to be. I do think that a good bit of it can be kind of uh, at least started and kind of get you off to the best next person. And that can be different depending on a patient's situation. So that's one that's kind of tough to answer just off the cuff. But I do think kind of starting at your home base, your family physician, your internal medicine, whoever your primary care doctor is, can be helpful in kind of pointing you that direction.
Awesome. Thank you so much. I wanted to hear your answer as a fellow family physician. I wanted to hear that plug for my own self. There's a question here that says, when I'm active, I don't have pain, but when I'm sedentary is when, my joints start to bother me. How would you recommend somebody deals with that, especially, in today's lifestyle where we do sit quite a bit for our jobs, we are sedentary quite a bit.
Yep. The biggest, if movement helps, I would try to move as much as possible. One thing that can be helpful if you're sitting a lot is trying to stand from time to time. I actually have a standing desk attachment thing on that lifts up the little tabletop just to get up and move around a little bit. Um, Other things, like I said, heat can be helpful in just kind of working on general mobility and stuff like that. But yeah, just if movement is helping, I would absolutely try to move as much as possible.
Thank you. And then, of course, keeping in mind that if someone is up and moving, not only is it helping your joints, but it's helping everything, including your heart and other areas of your body. Thoughts on CBD oil?
I do not have any personal experience with that. Unfortunately, to have a good answer, but I have had a lot of patients who swear by it. So I think similar to the glucosamine conversation, if that's something you've tried and it works for you, give it a go. Um, I am not. I don't think there are too many adverse effects of it, but if that's something that's working, it's worth a try.
Yeah, awesome. Agreed. There is a question here, which I think is a little bit funny because they did just have an article in the news about glasses of water per day. And they
Mhm.
said the old recommendation of 8 glasses of water per day is actually no longer necessary. What are your thoughts on that? And do you feel that water can help with inflammation?
So that's an interesting one. So water, when you're exercising and doing things like that, it's really essential just to keep you hydrated in general. If you're sweating, you're going to be more likely to get dehydrated. So we want to make sure that we're working through that. I don't know that there's a specific number that needs to be done, but when we're looking at the healthy lifestyle changes like weight management, stuff like that, we want to avoid sugary drinks and calories through fluids. So I don't think you need to lug around a gallon jug of water and make sure you drink that every day. But getting, six to eight, I think is probably a good goal for just your overall health, your kidney health, blood pressure, stuff like that.
Perfect, thank you. Yeah, that one's interesting. I think when you live in an area that's warmer and you're inherently thirsty, you'll drink more water. But for us here in Ohio, where everything is cold and dreary all the time, it's kind of hard to remember, like, oh, I actually need to drink water. That's part of life. Um, Baker's cyst. What can a person do to decrease pain in regards to a Baker's cyst, if anything?
So Baker's cyst, it's a it's a tough one. That typically is coming from something within the joint itself. If you've not seen someone to have X-rays and exam stuff like that for that, I would recommend that first, and then otherwise working on different exercises that aren't causing more pain to kind of work through specific strengthening of your quads and stuff like that to help kind of make the joint a little bit healthier. But if you haven't seen anyone for that in person, I would do that.
Thank you so much. There's also a question here that is fun. It's about cold plunges. And I think as we're going into the winter season, everyone is doing polar bear plunges. This is probably more in regards to, cryotherapy, but what are your thoughts on ice water submersion after an exercise?
Yeah, so there's actually some interesting stuff out there that can help with the acute inflammation, obviously, and then with recovery because it kind of just shocks the system and resets everything. Um, Is it going to be a cure-all? I highly doubt it. But it can be something that can help reduce inflammation. The other thing, a lot of the benefit that comes from a cold plunge specifically is kind of all of the mental health ideas that go around it too. It's really hard to focus on anything else other than being in a cold tub of water when it's 40 degrees and you're in it. And that can just kind of help with your mental health as well. So I think a lot of it kind of does that. But yeah, I've seen people that swear by doing a cold plunge. You want to be careful not to be in it too long or too frequent to get frostbite or anything like that. But a couple minutes here and there. The other thing is if you're having acute inflammation in a joint, it's like putting ice on it. So it can help kind of calm down inflammation and reduce swelling.
Follow-up question just of my own. For somebody who has known heart conditions, would you recommend that they talk to their physician prior to doing a cold water submersion?
If you have heart conditions, I would consider talking to a physician before you do any of these things that we talked about today. A good bit of it has probably already been discussed, but we definitely want to keep an eye on things if there's a heart history in a patient, as we're talking about exercise, weight training, stuff like that. Definitely would want to talk that over with someone prior to starting any of it.
Perfect. Thank you so much. And then on the opposite side, any tips on dealing with pain for during the cold weather when the cold weather flares our joints?
Yeah, that's the tough part of the year, especially here. It's trying to keep it warm and doing all the things we talked about, staying active as much as possible. The cold can absolutely aggravate arthritic joints and painful joints and make everything a little bit more stiff. So we just want to stay active, keep that mobility up, and keep those joints as warm as possible.
Thank you. And then I think we're getting close to time, but there are a couple of questions in regards to how much exercise can I do if I have X condition? If I don't have any pain, when do I know when to quit exercising? When should I anticipate arthritis? I presume your question or your response to these questions is just go until you don't work till the point of pain, but obviously do what you can.
Yeah, it's one of those $1 million questions, when to stop. But exercise is one of those things where too much of a good thing can be a bad thing. And there is a risk of overuse injuries and stuff like that too. So one thing you want to kind of be on the lookout is if you go on a run and typically the next day you aren't too tired, and you could run again, but you'll wait till the next day. That's okay. If you're waking up and you did a long run or a long bike or a lot of weight training and you're really tired, and you're just kind of not feeling up for it, sometimes that's the body saying, I need a break. And when you are in that situation, if you continue to do it, that's when we can get into overuse injuries, and that can lead to more chronic pain as well. So you kind of have to learn to listen to your body a little bit. But when you're noticing that you're just wiped out, sometimes that means we just need to take a minute off. As far as the longevity of things, that's impossible to tell. Um, uh, if we had a crystal ball and could figure that out, we probably wouldn't be here today. But basically, the biggest thing and one of the take home is just stay active. Staying active is going to help you stay active. So we want to continue moving and doing the best we can to keep mobile.
That's awesome. And I really like that last piece of advice. Is there anything that you would recommend just in general for these folks listening at home, other than the mobility that you just addressed? Is there anything that you would say, hey, I'm a PCP. I think this is really great for your joints. Keep this up, keep doing these types of things. Something you
Mhm.
say in your office to your patients.
Yeah, I would say that the number one thing is to keep moving. I say that all the time, and honestly, that can be walking. If one thing that you can incorporate is a 20 to 30-minute walk every day, that's going to help heart, lungs, joints, overall mental health, everything. So just going on a 20 to 30-minute walk every day is going to be huge. So that would be one thing to just kind of consider if you're not doing it already. Just incorporate a walk, no matter what your fitness level is. If you can get out, and go on a walk. I know the winter's rough, but getting out, moving, getting some. If the sun comes out, get some sunlight, with sunscreen. If you're in the summer in the sun, don't get sunburned. But yeah, just incorporate movement daily. That's going to help more than just about anything.
That's awesome. Thank you so much. And I think you would probably also say, like, if you could get someone to walk with you, there's also mood benefit in that, right?
Absolutely.
That's awesome. Thank you. Let me see here if there was anything else burning. I know there was a question about turmeric, but I think you addressed that a little
Mhm.
bit with the glucosamine chondroitin and that type of supplementation.
Mhm.
Um, oh, one question about steam and sauna rooms, hot therapy, which you've
Yes.
addressed a little bit, but
Yep, that can be similar to kind of how we were talking about, with the cold tub. That can help with the inflammation and stuff like that. But doing heat, a sauna, a steam room, a hot tub can really help with mobility and can get you warmed up. And you can stretch after that, and it has been shown to improve mobility. So that's absolutely something worth giving a shot if you have access to it. If you have stuff like low back pain too, it can help kind of loosen up the muscles back there, and get you working towards a recovery, as well. So yeah, heat can be your friend for sure.
and then I guess what's the biggest arthritic condition that you see in the office most frequently?
Knee arthritis is the most common, and I think, that with it's just we put a lot of pressure on our knees. They get us from A to B from the moment we start walking. So I think we just kind of wear them out. But yeah, knee arthritis is probably the number one that I see.
Awesome, thank you. Well, I think the questions have pretty much stopped coming in at this point. If there's anything else you'd like to address, that might be a good time. But yeah,
I think we're good. Thank you so much for attending, everyone. I hope you found this helpful. And like I said, if you have any questions, concerns, anything, come let us know, and we can help work through any of it. So if you need us, we're here.
thank you guys. Appreciate your time.